Welcome to Bronson Children's Hospital, Kalamazoo, Michigan. In this video, we will be showing you around the hospital, which will help you and your family have an idea of what to expect before the day of surgery. If you're feeling nervous or scared, our staff will make your hospital experience as comfortable as possible.
Before the day of surgery, a nurse will call your family to remind the day and time of surgery and ask about your health and medical history. These questions will be asked many times when you're here. We want to make sure we know all your health history so we can take very good care of you. Go over the packet given by the hospital with your family. They may bring a list of questions they might have for the surgeon and anesthesiologist. Make sure you pack special items such as your favorite stuffed animal, blanket, or toy. No food or drink after midnight the day before surgery. This means no gum, candy, or cough drops. Be careful when you brush your teeth. You don't want to swallow any toothpaste or water. Before going to bed, take a bath or shower. Put a fresh pair of PJs on, then get a good night's sleep in a pair of clean sheets.
The day of surgery, you will check in at the front desk on the second floor of the hospital. A pager will be given to you that will tell you when it's time to go back to the pre-op area, which is where you go before surgery to get ready. You will wait in the waiting room until you get called by a patient care assistant or a nurse.
Here is where you will meet the team, which may include patient care assistant, nurses, the child life specialist, surgeon, the doctor who will do your surgery, certified registered nurse anesthetist, CRNA, and the anesthesiologist, the doctor that will help you go to sleep and wake back up again, and answer any questions you or your family may have. In your room, the patient care assistant or nurse will check your weight and height first. Then they will check your temperature, your blood pressure, that feels like a squeeze around your arm, and put a red light sticker on your finger or toe to check your oxygen in your body. You will have special hospital pajamas, socks, and a funny blue hat to put on. You will have time to play, watch a movie, or relax before the surgery.
You will meet a doctor who is an anesthesiologist. Their job is to help you fall asleep for your surgery, take good care of you, and help you wake up when everything is done. They will listen to your heart and lungs before your surgery to make sure you're healthy. They will also talk with you and your family about how you will fall asleep, either using a breathing mask or an IV, which is a tiny straw that will go into a vein on your hand, arm, or foot. The IV is used to give you medicine. If you're feeling nervous, the anesthesiologist may decide to have the nurse give you medicine that will help to relax you and make you feel happy and goofy.
Your other doctor is a surgeon. Their job is to do the surgery. Your doctor will talk with you and your family about where they will do the surgery and how you may feel when you wake up after everything is done. They may look at the area of your body where they are going to do the surgery. Feel free to ask your surgeon any questions you have.
When it's time to go back to the operating room, you will have a choice to ride on a bed with wheels or in a wagon. You will give your family hugs and kisses before you go. They will wait in a waiting room, which you checked in at, until you are done with your surgery. Heading back into the operating room, it may be a little cold, which is why nurses bundle you up with warm blankets. You will never be alone. The nurses and staff will take good care of you.
Everyone in the operating room will be wearing special hats, gloves, and masks that will help keep out the germs. Once you're in the operating room, you will move from the bed with wheels to a special bed. The nurses will help you lay down. You will get a blood pressure cuff on your arm that feels like a squeeze. The red light sticker will go back on your finger or toe to watch the oxygen in your blood. 3 more stickers will go on your chest with wires connected to a monitor to watch how well your heart is doing while you are asleep. The anesthesiologist will help you to fall asleep using a special breathing mask with medicine. It will go over your mouth and nose. You will still be able to breathe and talk with it on. The mask will be connected to a special white tube with a balloon on the end. You will have to breathe or smell the medicine. Some kids say the air is a little stinky. We have special smells to put in the mask that will help. Most kids will get an IV while they are asleep. Sometimes kids may have to get an IV to help fall asleep before surgery. If you have to get an IV before falling asleep, you will get that in the pre-op area before going to the OR. The nurses will explain and put the IV in for you. The IV is a small, tiny straw that goes in your vein that gives your body medicine or water. Your veins are those blue lines you see in your hand, arm, or foot. To get the tiny straw in your vein, there is a little poke. The nurses have ways to help make that poke not hurt as much. Once the straw is in your vein, the poke is gone, and all there is left is a plastic bendy straw. There will be some tape wrapped around to keep the straw in your vein. If you get the IV while you are asleep, you won't feel anything at all and will see it in your hand or foot when you wake up. Once you fall asleep for surgery, you won't feel, hear, or see anything and won't wake up until everything is over.
When the surgery is over, you will go to the recovery room, or as I like to call it, the wake-up room, where the nurse can watch over you. The doctor will let your family know how you're doing. When you wake up, you may see the IV and have a sticker with a red light on either your finger or toe. The nurse will call your family so they can be there when you start to wake up. You will be able to have a popsicle or some small sips of water. When the nurses think you're ready to go home, they will slide out the IV, take the red light sticker off your finger or toe, and let you get your own clothes back on. The nurse will provide your family with information on how to take care of you at home. You will be able to ride in a wheelchair to your car. Some kids may go home the same day after surgery, and some kids stay overnight.
If you have to spend the night, you will have a new room in a different part of the hospital. There will be nurses to take care of you. They will continue to check your temperature, blood pressure, and oxygen. You may meet our child life specialist that provides emotional support, coping strategies, and therapeutic activities, such as movies, crafts, games, and toys that will help make your hospital stay more comfortable. They can explain or answer any questions you may have about your hospital stay. When the doctors and your family feel that you are ready, they will let you go home. When you are dressed, someone will walk you and your family out. At Bronson Children's Hospital, we promise you and your family the best care possible. If you have any questions, be sure to ask your family. It's a good idea to check out some books about going to the hospital before your day of surgery. You may be able to attend one of our preoperative tours to get your questions answered as well.
Thank you for choosing Bronson Children's Hospital.
We are proud to provide the best care possible for you and your family.